Suzy Fortin is a 63-year-old retired medical imaging technician who has been treated by the palliative home care team for the past 3 months. Mrs. Fortin was diagnosed with cancer of the intestine and underwent surgery 3 years ago. She underwent chemotherapy and radiotherapy at the time of her diagnosis. 2 months ago, Mrs. Fortin began to experience pain in her hips. Her oncologist ordered a CAT scan, which revealed metastasis in her ribs, pelvis, and lumbar spine. Mrs. Fortin and her husband met with the oncology team and decided not to pursue treatment. The home care team has been following Mrs. Fortin since that time. Her husband was the primary caregiver. Today, Mrs. Fortin is admitted to a palliative care facility. It is 2 p.m. and you are admitting Mrs. Fortin to the facility. At the beginning of each shift, it is important for the nurse to introduce herself to the users. The nurse states her name and position. In a palliative care setting such as this one, it is essential to apply the basic principles of communication and to quickly establish a therapeutic relationship with the user. The nurse's soft skills are her main tool in creating a bond of trust with the user and her family.
Hi, Mrs. Fortin. My name is Mary. I will be taking care of you here. You seem sad. Is there anything wrong?
Oh, there's a lot of reasons I'm crying.
Mm-hmm. Would you like to talk about it?
Yeah, okay.
Can I sit down?
Yeah, sure.
Validating the user's willingness to engage in a discussion is critical. If the nurse does not verify if the user is willing to talk, then it can make the user feel pressured to do so, which may cause dissatisfaction and frustration.
Can you tell me what's making you cry?
Well, it's kind of because I feel relieved to be here.
Relieved? Can you explain to me how you feel relieved?
Well, you know, at home it was getting really hard. I was always tired, and then I had trouble doing stuff for myself, you know, taking care of myself, and then I was afraid that I'd become a burden on my husband and my family, and I mean, I was just afraid he was going to get, you know, he was going to become exhausted and not be able to take care of me anymore.
Right.
So
the nurse should always ask permission before entering the client's personal space. She makes sure to ask the user open-ended questions. An open-ended question allows for communication of emotions and feelings. A conversation where open-ended questions are used is more dynamic and does not dry up as easily as a conversation with closed-ended questions. Here, the nurse uses an open-ending explanatory question. This type of question is mostly used to ask for clarifications, such as the reasons why the user is crying.
So, what are you worried about exactly?
Well, like I said, you know, I was worrying about my husband not being able to take care of me and do, like, it's getting harder and harder for me to do things for myself. So I always have to ask my husband to help me, and
and so you feel a bit relieved. That's why you cried.
Yeah, I feel relieved to be here now.
Yes.
Yeah, yeah.
That's okay.
Really. Yeah.
Here, an explanatory question is used to obtain clarification about something in particular. In this case, the nurse wants to understand what the user's worries are for her husband. During a therapeutic interview, the nurse uses reformulation, which is an essential element of active listening. It allows the user to feel listened to and confirms that the nurse understands the user's situation. When the nurse uses reformulation, it is essential that the words she uses remain as close as possible to the meaning of the words expressed by the client. However, be careful not to use parrot speech, which means repeating exactly what the client said using the same words.
So you are in the right place. So the nursing staff here will take good care of you, will meet all your needs. It will allow you to have some tender and calm moments with your family, with your husband, without having to worry about unfortunate events or becoming exhausted.
Yeah, that's what I was hoping for. You know, it's hard for them to watch me like that, and I was, you know, I was afraid that they'd have to watch me just, you know,
No, I understand.
fading away, and
Yeah.
so it's a relief. Yeah.
So you said you cried for a lot of reasons. What are they?
Well, there's anger. It's really strong, and sometimes it's so strong that it brings me to tears. I mean, it makes me cry.
It's okay. And you can share all your emotions, even the dark ones, with me. That's okay.
Yeah, okay. And, well, I'm angry because this is the second time. I mean, I had this before. I had this cancer. I went through all the treatments, and now it's back, and I have to go through everything again. It's just not fair. And it's just not fair.
I understand.
Once again, the nurse uses rephrasing to ask an open-ended descriptive question. The nurse also uses intentional affective touch. Touch is used by the nurse to show her understanding when words become superfluous and are no longer able to comfort.
Okay. So your decision with the treatments, how's it going?
Well, I decided that I didn't want to have any more treatments.
Okay.
Yeah. But then at first, like my kids, and my husband, they wouldn't hear of any of that. They wanted me to continue and that, but we had a long talk.
Okay.
You know, everybody was able to express their feelings about it, and
what motivated that decision of stopping the treatments?
well, it's just that the doctor explained to me that the treatments would not cure me. It would only prolong my illness,
Right.
prolong my life. But, I mean, I don't want my kids to see me wasting away in pain and in... So I want to be able to have some nice time with them before I leave, before I go.
Okay, so
So,
prolonging your life with the side effects of the treatment was not an option for you.
exactly.
You're
Yeah.
very brave.
Oh.
So your family, they understand now? They
Yeah,
accept
they
it?
came around.
Okay.
They came around. I mean, it's hard for them, but
It is,
they came around. They agree with me now.
That's very brave. So you also mentioned anger earlier. So what are you angry about exactly?
Well, I'm angry because this disease came back, and I'm still young.
You are.
And I just hate to think that I won't get to see my grandchildren. They won't get to see me, my children, my family. It's not fair. I mean, I'm still young. I just retired. Now I can't even enjoy my retirement. It's not fair.
No, you're absolutely right. I'm glad I can be of any help, okay? If there's anything I can do.
Oh, thanks for listening to me. It really helps.
It's
You know, I can't say those things to my husband and my family. It's hard for them when I try to express when I'm upset. You know, it makes them sad and makes them feel bad, and so it really helps me
okay.
to talk to you like that. Thanks.
Good. It's nothing. So, is there anything else I can do before your family arrives? Is there anything I can help you with?
Well, yeah. Do you think you could give me something for the pain?
Okay. So what caused this pain?
Well, it's when they transferred me from home to here. The
Okay.
pain, I always have it, but the pain got worse.
Okay. And can you describe it to me, how it feels, the pain?
Well, it's in my abdomen here,
Okay.
and it's like a throbbing pain, and
Okay.
it's like I feel like I'm being stabbed in the abdomen.
Okay.
It really hurts.
Okay. And on a scale of 0 to 10, 10 being the worst pain in your life, how would you rate it?
Oh, I'd say an easy 7.
Okay.
Yeah.
Okay. And is it just in your abdomen, or is it elsewhere? Do you feel it somewhere else?
Well, it's
or-
mostly in my abdomen. Yeah.
Okay. And how long have you had this pain?
Well, the stronger pain like I have it now, it's been about 10 minutes. I had it before,
Okay.
mind you, but it's getting worse. It's been, in the past 10 minutes, it's really gotten worse.
Okay.
So I'd like to have some medication if it's
So, yeah,
possible.
how did you deal with the pain when you were home?
Well, my husband would give me a sedative.
Okay. A sedative in pill form?
Yeah, and there's pills. The doctor gave him some pills for me.
Okay.
And when I needed them, he gave me some pills.
Okay. We might have an option of having an injection for pain medication. Have you heard about that?
Yeah, the doctor told me that if I asked for my medicine in injection, that it would relieve me more quickly.
I would have to check with the doctor's prescription in your file, but it could be an option. That would be something you would want?
Yeah,
Okay.
really.
Yes, it's quite simple, actually. We install a device either in your thigh or your arm. It's called a subcutaneous winged microinfuser. And basically, it's just so that we don't have to give you a shot every single time. So there's like a single injection at the beginning when we install it, and it stays for 72 hours, and you get your pain medication through that.
Oh, I'd like that.
Yes?
Yeah.
Okay, then I can go check your file, and I'll be right back.
Okay.
Okay.
I really would like that. Yeah.
It's my pleasure. It's really an honor to be able to accompany you.
Thank you.
I'll be right back.
Thank you.